Hi, my name is Rebecca Petras, and thank you very much for the introduction, and thank you for coming to listen to me talk about my passion. I'm going to talk to you about the ultimate symbol of local but global language. All of us here in this room speak English. It's the global language, right? But when we have a problem, when we are sick, when someone we care about is hurting, we revert to the local language, whether it's South African English, Russian, Spanish, Portuguese, whatever. It's our local language that goes to our heart. And that's what I'm going to talk about today. I'm going to start with some numbers. I'm really bad at math. My kids remind me all the time, so I made it really simple. We have 7 billion people in the world, give or take. Of those, about 1 billion speak English. Now that includes you, me, I'm a native English speaker. It includes somebody who's third language English speaker, but really does understand it. That's about 1 billion people, okay? 6 billion. That's what we end up with when we take that billion away. Those are the people who do not communicate in English at all. And those are the people that I want to talk about today. And they're the people that I worry about every day. Nobody said it better than Nelson Mandela. When you speak someone's own language, it goes to their heart. So I feel this all the time because I live in Russia. I've been here 4 months. I barely speak Russian. I mean, really very little. Today I was at the park this morning with my dog. We go to the local park. Everybody knows him. He's really friendly. His name is Harvey. And this lady came up to me and said, "Hi, good morning," in perfect English. It just made my day. It was the most amazing thing because it went to my heart. Every day I go through the streets, I make sure I say Dobry din. I try to say Zdrastia, but I can't. And I try really, really hard. But when somebody speaks my language, it goes right to my heart, and it matters. And that's what I do every day, and that's why language matters. It also matters in life and death situations. We hear a lot about Ebola. We hear a lot about AIDS, all these great killers in Africa. And the fact of the matter is that diarrhea kills more children in Africa than any of those diseases. Why? It's really quite simple to treat diarrhea. This is how do you treat diarrhea in Russian. Now, as I said, I don't really speak Russian, but being someone who goes to the grocery store, I pretty much know 3 of those words. And I can figure out, I need water, I need sugar, and I need salt. But that other word there, not so sure. Not sure what that means. Either was Reverend Saley and his wife. They gave their daughter water, sugar, salt, but they did not boil that water. And their child lost her life to diarrhea. One word, that matters. It also matters to Regina. She's a woman I met in Tang Valley in Kenya. It's not far from Nairobi. But in Tang, no one speaks English. Not at all. She has HIV. She is HIV positive and has recently become full-blown AIDS. She gets medicine every day, follows a very strict regimen with her community health worker who speaks some Swahili, her language. All of the directions she gets, everything is in English, Portuguese, and French. How can we expect her to do as well taking care of her disease as we would expect ourselves to do, and as we would expect our doctors to do for us? And then I take you to the Philippines. About 13 months ago, there was a super typhoon called Haiyan. I'm sure you're familiar with it. Before the typhoon hit, we were told, as an organization that focuses on language, don't worry about it, everybody speaks English. Not a problem, you guys don't need to do anything. Radio reports, Doctors Without Borders told us, radio reports said there's a big wave coming. There's a big wave coming. Oh, big wave. I've dealt with a big wave before, right? The people on the coast did not understand what big wave meant. They had heard the word tsunami. They knew the word tsunami. They did not evacuate because tsunami was not reported, and 7,000 people died. And now to West Africa, the modern era's worst health emergency, according to the WHO. The worst place, the epicenter, is Sierra Leone. Now we've heard, probably you've heard, that in fact they're getting things under control in Liberia. Nigeria got it under control. What was the difference? The difference was information. The difference was a gap in language. So what's going on in Sierra Leone? Well, 13% of women in Sierra Leone speak English. 13%. Simple math, we know that 87% do not. Now, the 13% who speak English in Sierra Leone primarily live in Freetown, which is the main city of Sierra Leone, where there is not Ebola. So, we give this information to these women, the main sufferers of the disease, the carers for those who are sick, the carers for the orphans who have lost both parents. We give it to them in English. How can we expect them to understand when we do not speak their language? There are 90 languages spoken in those 3 countries. 90, okay? 25 in Sierra Leone, 6 million people, 25 languages. Oh, the official language is English, of course. Must be okay, right? 90% of the people communicate in Creole. They do not speak English outside of Freetown. Ask any aid worker who's there right now. The epicenter is in the crossroads of those 3 countries, far from Freetown, very far. There is not English spoken there. How can we expect them to understand not to eat bushmeat, to understand to stay away from people who are really sick, to not give them a hug? We need to speak to them in their language. In West Africa, the Ebola crisis is a crisis of information. It is a crisis of language. The top medical professional at International SOS said, it is important to provide medically accurate and easy to understand Ebola information in a community's local language. It is not okay to spend millions or billions of dollars throwing English information to people who have no idea what it says. So that's what we focus on at Translators Without Borders. Our vision, our whole reason for being comes from 2010 and from a report that it was from the Harvard Humanitarian Initiative after the Haiti earthquake. And what this said was that language and the lack of translation is a perennial issue in care, in nonprofit care, in humanitarian care around the world. And it was in Haiti, 2010, big earthquake, hundreds of thousands lost their lives and their homes and their livelihoods, that the translation industry, the industry that I'm very involved in, really woke up, really understood that we can make a difference, that words make a difference. People in Haiti speak Haitian Creole. When the earthquake initially happened, people poured in French aid workers. Haitian Creole is like French, right? No problem. Well, the SMSs that came in were all in Haitian Creole. Nobody understood. We had thousands of translators, diaspora around the world, translating 24/7 to find people, to find them under the rubble, to help them, to give doctors information about what's wrong with someone, to give them triage. This was a huge wake-up call that language is an issue. And my organization, Translators Without Borders, was really born out of that crisis. We believe in a world where knowledge knows no language barriers. This is what our vision is for the world. And like Mr. Khan said, you can't solve every problem, but you can solve any problem. This is the problem that I focus on. I focus on language. Other people focus on tents, or mosquito nets, or wells in villages in Africa. I focus on language. I take that one problem, that one gap, and I try to solve it. And we do that 3 ways. We do it by connecting, building, and advocating. How do we connect? We work with thousands of professional translators around the world who translate into 100 or more languages to let people get the right information. We've done 22 million words in 2.5 years. We work with all the major aid organizations, the Red Cross, the Red Crescent Societies, Médecins Sans Frontières, Save the Children, World Food Program, 350 nonprofit organizations and government agencies as well to get information into local languages. We train new translators. There are a lot of places in the world where there isn't any translator. I mean, if you go to the Philippines, to Ware, you cannot find a translator. They do not exist. So what we do is we teach them new technologies. We bring people in, we pay them to do training, we teach them how to use technology to do fast translation. In fact, we also train the engine in the languages where Google Translate does not exist. I mean, you know, here in Russia, if you don't understand something, you go to Translate, you understand it, it's no problem. Well, that cannot happen in Africa. That does not happen with Swahili. That does not happen with Amharic or Hausa. So we are working with new translators in Africa to help them build those engines so that in the end, they can use Google Translate or they can use Microsoft Translator to get their translations. And we work with Wikipedia extensively. Now, I understand, having 3 kids, that in fact, teachers do not like you to use Wikipedia as a source. And there's good reason for that. In fact, the founder of Wikipedia would say, do not use Wikipedia as a source, which is a shame. However, there is a group within Wikipedia that is medical professionals, and they work night and day to make sure that the top 100 medical articles on Wikipedia are perfectly sound, are vetted by professionals, and even published in medical journals. Why is that so important? Because Wikipedia is the #1 medical source online today. And it's not just the #1 source for you and me. It is the #1 source for doctors and nurses and people who are trying to help people around the world. So making sure those articles are in perfect shape is really, really important. We then take those articles, we simplify them, and we put them in 100 languages and get them online. There are lots of places in this world where that doesn't really matter because nobody's online. They don't sit in front of the computer like we do all day, but they do have phones. And Wikipedia makes their articles, these 100 medical articles, available on phones for free all across Africa, India, and the Middle East. And as I mentioned, we respond to crises. In the last 2 years, actually about last 18 months, we've responded to 7 crises. Those include the Balkan flooding, earthquakes in India, 2 typhoons in the Philippines, Kenyan elections, and of course, Ebola. We've done that in 28 languages. We've informed more than 100 million people, and we've airlifted 2 children out of the Philippines who could not speak a word of English, who needed to get out, who were orphaned. We got them out using our translator. So I take you back to West Africa. What does it mean to translate? Why is it important? Well, this is an example of something that we do for a local language called Creole in Sierra Leone. And we provide posters that are then actually put in villages, and Doctors Without Borders and the Centers for Disease Control work with people specifically using their language to explain why they need to be careful, how to bury someone, what meat they shouldn't eat. So we provide an enormous amount of information from our translators into the 7 local languages. We let the rest of the world know that it's only in West Africa. There's a big, big fear about Ebola. We've translated no Ebola into 45 languages. This is Amharic for East Africa. And letting people know that, in fact, it is okay. It is only in West Africa. You're okay. You're safe in East Africa or South Africa or wherever you are. Very simple, but this is how a doctor communicates. This is for Haiti, and this is just triage usage, so that when somebody says, my knee hurts, they don't say it in knee, they say genou, and the doctor can understand them. Words matter. English for the doctor, Creole for the, Haitian Creole for the patient. Again, words matter. So what I care about is information and getting it out in the right language. A fellow TEDx speaker, Sandra Fisher Martins, in 2011 coined a phrase called information apartheid. That is the gap, the enormous inequality between people who have information, you guys and me, and people who don't. That phrase, information apartheid, has been used over and over again since then by the Gates Foundation, by Mark Zuckerberg, by many others who care about getting information out. And your generation will be the forebears, the ones who really make sure that we take that gap and we eliminate it. We make sure that people in South Africa, sub-Saharan Africa, or India, or wherever they are, understand. We can use technology. In fact, we can sit in Moscow, like I do, every day, working with thousands of people around the world. I work with over 3,500 people. These are a few of them. Using technology to make sure the parents of these kids know how to treat diarrhea, so that when they get it, they will be safe. And that's what I do. Thanks.